My name is Teresa Lee, and this is my cardiovascular exam video for MSN 572, and today is June 2nd, 2024. Okay. Okay, so we're gonna go ahead and get started. Before we do anything, I just need your consent to do the assessment as well as posting it on YouTube for my instructor to grade.
Okay.
Perfect. Okay, so I'm gonna go ahead and wash my hands. Okay, so starting the cardiovascular exam, I am just noticing noticing for any chest abnormalities. I don't see any sternal abnormalities either. She doesn't have any pectus excavatum or pectus carinatum. Next, I'm gonna lay you back 30 degrees to check for jugular venous pressure. And then I'll have you go ahead and look to your left. And I'm looking for the highest point of oscillation here against her sternal notch. I'm actually put you down a little bit more. Perfect. And then using the ruler on the back of my chart here, I'm going to place it at her sternal notch. And then this place card, or this note card. And measures at 2 centimeters, which is a normal finding. Anything under 3 centimeters is a normal finding. Next, I'm going to check her carotid pulses. So I'm just going to palpate her carotid pulses on the right hand side here. And then go ahead and turn this way. And I'm doing it one at a time. They were equal bilaterally and 2+ pulses. Next, I'm going to auscultate for her carotid pulses. So I'll have you turn slightly to the left again. And then go ahead and hold your breath. I'm having her hold her breath so that I don't hear any breath sounds. Perfect, and other side. Perfect, and I did not hear any bruise bilaterally. All right, and then continuing my inspection, I don't see any apical, I don't see the apical impulse, which is a normal finding. There are no precordial impulses visible either, and that is a normal finding. Next, I'm going to palpate for her point of maximum intensity, and that is at the mid-clavicular line at the 5th intercostal space. So I'm going to go ahead and feel for that here. And I do feel that it's a brisk tapping, and that is a normal finding. If I was unable to feel for it, I would have her turn on her left side and then holding her deep breath in. Next, I'm going to palpate the different auscultatory areas, which are the aortic, pulmonic, Erb's point, tricuspid, and mitral. So the aortic is in the right sternal border at the 2nd intercostal space. Pulmonic is left sternal border at the 2nd intercostal space. Erb's point is left sternal border, 3rd intercostal space. Tricuspid is left sternal border, 4th intercostal space, and then the mitral is the left mid-clavicular line at the 5th intercostal space. So upon palpation, I am checking for thrills, heaves, or lifts. With the balls of my hands, I'm going to be feeling for thrills, and then I'm going to switch over to my finger pads to feel for any heaves or lifts. So I'm going to go ahead and do that now. Perfect, and I I did not feel any thrills, heaves, or lifts there. Next, I'm going to palpate for her abdominal aorta, which is going to be in her epigastric area here and slightly to the left. And I am able to feel her aorta pulsating width of about 2 centimeters, and that is a normal finding. Anything between 2 to 3 centimeters is a normal finding. I also did not feel any pulsatile masses or any evidence of aneurysms. Next, I'm going to auscultate these same areas, and I am listening for any bruits, or I'm sorry, not bruits. I'm looking for any murmurs, gallops, clicks, or revs. And so again, starting in the aortic. And then I'm going to switch and listen with the bell. With the bell. And diaphragm. The diaphragm. And bell. And so far I have not heard any murmurs, clicks, or revs. And I'm at the tricuspid with the bell. And the diaphragm. And mitral with the diaphragm. And then the bell. And again, I did not hear any murmurs, clicks, or revs, or any gallops in any of those areas. Lastly, I'm going to auscultate the S2 again. I'm listening for, I'm going to listen at the pulmonic area for physiologic splitting of S2. It's best heard during inspiration, and it occurs when there is lower vascular resistance on the pulmonic artery during inspiration and delays pulmonic valve closure. Okay, and I did not hear clicking, but it is a normal finding to be able to hear it. Okay. Next, I'm just going to look at her extremities. I don't see any edema in her upper extremities and no edema in her lower extremities. Looking at her hands and fingers, I don't see any signs of cyanosis. I'm going to go ahead and palpate her carotid pulses. And they are non-bounding, regular 2+ bilaterally. And then going back to extremities real quick, I don't see any varicose veins or shunts along with the edema, and then no leg trauma. And then brachial pulses. Again, regular 2+ and equal bilaterally. And then I'm going to check her femoral. Usually this would be done under the clothes, but for modesty, we will go over. And I'm just going to auscultate first, both sides. Okay, no bruits heard. No bruits heard. Next, I'm going to palpate her femoral pulses, and I do not, I do feel her pulses here. They are regular and 2+ bilaterally and equal. Next is her popliteal, which is in the fossa medially behind her knees here. Perfect, and again, that is regular, 2+ and equal bilaterally. Then we've got posterior tibial and dorsalis pedis on the feet. And again, both pulses were equal bilaterally, 2+ and normal. Next, I'm going to check your capillary refill in your fingers. Okay, and those are less than 3 seconds, which is a normal finding. And then also with the toes. And it was also less than 3 seconds, and that's a normal finding. Lastly, I am just noticing her fingers and her toes. I don't notice any clubbing, no cyanosis, no tar staining, and no splint hemorrhages. And I believe that's it. Thank you.